Hi, my name is Dr. Sylvester Black. I'm a transplant surgeon here at the Ohio State University Wexner Medical Center. My job at Ohio State is threefold. As a liver transplant surgeon, I first have to evaluate patients prior to surgery to determine their suitability for surgery. This occurs with both the donor and the recipient. Second, I lead the team that performs the liver transplant operation. And third, I follow patients afterwards for a period of a year to make sure they recover fully from their operation. The question that we get often is, what is the difference between a live donor liver transplant and a deceased donor liver transplant? A live donor liver transplant essentially takes part of the liver, so up to 70% if we're taking the right side of the liver, or 30% if we're taking the left side of the liver. That smaller piece of liver, though, will regenerate in 6 to 8 weeks. So the deceased donor transplant takes the entire liver, so 100% of the liver. It's a larger segment of the liver, and the liver doesn't need to regenerate post-surgery. So you get the full benefit of an entire liver. However, the outcomes are actually as good or better with living donor transplantation. So when we look at a patient in the pre-op situation where we're looking at the images that we take and we get CT scans and MRIs, we're able to actually reconstruct the liver and do a three-dimensional simulation of the liver. And as the surgeon, I'm able to see all the different blood vessels and the bile ducts and know exactly where to cut. And depending on the way the anatomy is, and everybody's anatomy is slightly different with living donor surgery or with liver surgery in general, that we're able to decide if the anatomy is more suitable for a right lobe donation or a left lobe donation. We are trying to minimize risk to the donor to make the operation absolutely as safe as it possibly can be. And so looking at the anatomy, whenever the anatomy is favorable, whether it's for a right-sided donation or a left-sided donation, that will dictate what side we choose. The risks for a living donor are the same as any major liver procedure, and that can include mainly bile duct complications. And the bile duct is a tube that drains bile that's made in your liver to your digestive tract to help you break down fatty foods. And that's the area in liver surgery that can be injured when you have to basically split the liver in half. This is a very, very minor risk as we take a lot of pictures in the operating room to ensure that we're being safe. The patients tend to recover very, very quickly. They're out of the hospital in 4 to 5 days and back to 100% within 8 weeks. The liver grows back to its full size, or about 95% of its size, in 8 weeks' time. There are no restrictions after 8 weeks. The lifting restrictions occur within the first 8 weeks, where we don't want you lifting anything heavier than 10 to 15 pounds. The process for donor surgery and recipient surgery is that the donor goes into the operating room slightly before the recipient. After the donor gets the appropriate medications, the donor is put to sleep, and we start the operation by making an incision, usually up and down along the midline of the abdomen, and we expose the liver. We take pictures of the liver and make sure all the anatomy is actually correct before proceeding. And then we bring the recipient and we stagger the operations by about an hour to an hour and a half. And then once the recipient is in the operating room, we start to split the liver in half. And then when the recipient team is ready, we take the liver out of the donor and bring it over to the recipient room to start the implantation part of the procedure. The whole operation takes anywhere from, counting the donor and recipient, 4 to 6 hours. The recovery time after surgery is pretty quick. The donor is essentially eating solid foods by day 1, walking the hallways by day 1, and then generally by day 4 to 5, they're able to go home. They come back to see the surgeon in clinic once a week for the first couple of weeks, and then once that happens, then they follow less frequently. We do get labs in clinic and make sure that the liver function is excellent, but most donors recover fully by 2 months. Living donors live just as long as people that have not donated, and in fact, there are no significant long-term health risks with living donation. Recovery for the recipient after a living donation procedure is essentially the same as it is for a deceased donation procedure. It generally requires about 7 to 10 days in the hospital. You follow up in clinic after you're discharged from the hospital, usually on day 10, once a week for the first 3 months, where we adjust your immunosuppression medications to make sure that everything is within the appropriate therapeutic ranges. The long-term outcomes are actually slightly better from a live donor than they are from a deceased donor. And so the survival rates are very, very, very high. And there's a couple of reasons for this. The first reason is that it turns essentially a non-elective procedure into an elective procedure where we can do the operation at the time that's best for the recipient. And then the time that the patient gets the operation, they tend to be much less sick. So their recovery time is shortened. They're able to get back to their full function much quicker.